Hello everyone, my name is Marta and I'm here today to talk about schizophrenia. My talk will be focused on the diagnostics and the symptoms of the illness. The symptoms of schizophrenia are divided in positive and negative. The positive symptoms are the auditory hallucinations when people hear voices and most of the time comes from inside. Delusions or paranoid behaviors. It's sometimes people say that they think someone's following, or sometimes they even think that the neighbors are trying to record what they are saying. Some very weird kind of behavior. Negative symptoms are the inability to pay attention, apathy, it's a kind of indifference, social withdrawal, and the extreme difficulty to organize your thoughts and speech. I also add some of the cognitive symptoms that I see in people with schizophrenia. So problems with attention, concentration, memory, and decline in education performance, and of course will be a decline as well in your functions at work. Some of those cognitive symptoms are seen as the negative symptoms of the disease. In here you have a screen that's showing the activity of regions of the brain that is related to language. In some studies use the fMRI, they were able to see that with a patient having verbal hallucination, so the same areas of the brain was activated, what I find was incredible. The diagnostic criteria are based, like say, at least 2 of the positives or negative symptoms lasting for 1 month. For example, if a person experiencing some kind of delusional and as well like social withdrawing, that can be a case of the diagnosis of schizophrenia. Only one symptom is required if it's the case of very unusual delusion and hallucination, such as running commentary on the person's behavior or thoughts, and the 2 or more voices converse with each other. So when this happening, it's like the person is finding very hard to continue their activities, everyday activities, because this kind of delusion and hallucination is all the time in their mind. And any of the following symptoms in a severe form lasting for more than 6 months can be a case as well of schizophrenia. So dysfunction in work, interpersonal relationships, or self-care throughout most of the illness. Decrease of the level of achievement previously experienced by the patients before the onset of the illness. Other symptoms, so mood imbalance, not evident after the onset of the psychotic episodes. So the psychotic episodes are the hallucinations and delusions. Illness not related to substance abuse or any other medical conditions or medication, and illness not part of the autism or other severe developmental disorder. Challenge of the diagnosis, I add here the depression. So clinical depression normally presents those symptoms of poor concentration, avoid of social interactions, not to get the same pleasure for the usual activities. And that those symptoms, of course, can be easily confused with apathy. That's this kind of indifference that I cited before, and that the negative symptoms. And I myself knew a person that had been treated for clinical depression for many years because present all these symptoms, but didn't have psychotic episodes, so and they were not able to see that was a case of a schizophrenic. Only after the person had the psychotic episode that then was diagnosed as a schizophrenia, and today this person is receiving treatment for schizophrenia. So another challenge that can be for the diagnosis of the schizophrenia is some symptoms. Most of the time, schizophrenia appears during the teenage years, and some teenage behaviors such as like sleeping problems, cause irritability and drop in grades, change of friends, and it's as well can be like very difficult to see these as symptoms of negative symptoms of this schizophrenia. And in this part, I just add some studies that use different methodologies like CT, MRI, and the postmortem. And in this time, they found that lateral ventricles enlargement, which was linked with the severity of illness, poor treatment response, and neuropsychological irregularities. Other neuroscience studies use MRI, the fMRI, so the disconnection between brain areas, frontotemporal disassociation it's called, implying cognitive deficit in schizophrenia. As well, in PET studies and breast implant study, it was showing a reduction of blood flow in the front lobes. It's called hypofrontality. And hyperfrontality in some studies indicate positive correlation with chronicity, negative symptoms, and neuropsychological task impairment. These studies that saw the reduction of blood flow in the front lobes was not always replicated the same findings. So they also saw an increase of dopamine receptors density and as well a reduction of the receptor density in the prefrontal cortex. Reinforced the importance of the neurotransmitter dopamine in schizophrenia. The hypothesis that schizophrenia can be caused by the imbalance of the dopamine neurotransmitter, and in this case, like you have the antipsychotics that are used to treat patients with schizophrenia, and they do work to, in many cases, to eliminate or minimize the positive symptoms, hallucination, and delusion, and they like decrease or block the dopamine neurotransmitters. And that's all that I have for today. Thanks very much for your attention.